Hi everyone, I'm excited about tonight. We have Dr. Reddy on. He'll be on in about 5 minutes. We're going to be talking about diabetes again in part 2. So let me get everybody on here. I'm going to get Terry on and bring Mel on, and then we're going to bring Dr. Reddy on. I'm excited tonight. There she is. Hello, how are you?
Good. We should have a good show tonight.
I know, I'm really excited, where he's going to finish up talking about diabetes tonight. So I'm really excited about that.
I like the hair.
Well, I couldn't do anything with it. So this is it for tonight. How was your ski trip? Did you have a good time?
Yeah, it was really good. It was. The
Good.
snow was great. I had a guy accidentally slam my hand into the door, and he closed the door for 30 seconds, Peg.
Oh my
And I
God,
kept
that's
screaming. It
terrible.
was the van taking to the gondola, and I kept screaming, open the door, and he couldn't hear me. Yeah, pretty swollen, but I'm
Let me
good.
see. Let me see it.
It's not bad now. You
Oh
can't
my
tell
God, you
now.
poor thing. Oh,
I
that must have
heal
hurt.
quickly. It's all that Vascepa I take.
It was funny because I had my appointment with my hormone doctor today and we were talking about that. So yeah, it was really interesting. So
Yeah, I've been taking my stuff, but it was a great trip, and I'm
oh,
back to
good.
work. And you know where I'm doing this from? I'm doing it in my closet.
Good for you. Well,
Remember the closet?
inside the
They said
closet.
there's no sound. Who's not hearing us?
Uh-oh. Let's see. Maybe it's on their end. All right.
Yeah.
Let me inside the closet. We should just have a podcast on just inside the closet. There was a lot of stuff shared inside the closet, wasn't there?
Oh my God, that was our safe place.
That was our safe
Safe
place.
place. Yes.
All right, everybody. Hold on. Let me get Mel on
Now they said
here.
Brent said she could hear fine. So
Okay, good. So
Benny, you're
there's
gonna have
Mel.
to fix your Instagram, love. It's not. It's on your end. Hey,
All right.
Mel.
There's
What
Mel.
what what about me? What about me?
What? Hi, honey. How
Hi,
are
honey.
you?
What
Hi,
about
Hello,
me?
honey.
honey.
What about
Hi,
Hi, honey. What about me?
honey. Wait, you're coming. I wanted to have a
We
minute
can
or
hear
two
you
with my
loud and
All
girl.
the
clear.
secret clandestine off
No, look,
camera.
we were talking about the
No.
closet.
I
You
heard
weren't in
it.
the closet.
I
Oh,
heard
did
it.
you hear it?
I
Yeah,
heard it.
we were talking
I
about the
heard about the
closet.
hand too. Um,
And
Hey, it's girl talk. We get a few minutes of girl talk before we start the show because it's two men, and
that's
then we'll
right.
be ready.
it's all right.
Exactly. Yeah. So, but you had a good time skiing. She had a great time.
I did have a good
Whistler.
time. I'm going again in 2 weeks to my
Must be nice.
place.
Must be
Well,
nice.
do
Oh,
you? Hey, wait, Mel, do you ski?
I used to, but not anymore.
Yeah, you guys could. Peg, you need to come with me.
I snowboard.
Yep, you need to
You know
come
what?
with
I was
me.
like, yeah, Copper. I used to take Dakota to Copper Mountain all the time in Colorado. We used to go
Yeah,
there at least once or twice a year. Yeah, because I have a girlfriend that lives up there.
it would
So I
be
taught her how to.
fun.
She was about 6 years old, and I taught her how to snowboard. Yeah, she was a little badass when she got older. She
It
was
would
really
be fun.
good.
Is Doctor Reddy on call here? Is he ready? Doctor
Yes.
Reddy ready?
Is ready?
Ready is ready, everybody. All right, I'm
Ready.
excited. Here we go. Hold on. Let me go find
Mel, I
them.
like your setup there.
Well, I'm trying to find the most comfortable spot I have seat wise. So I'm
That's
experimenting with other places in my
that helps.
That's a
house.
Yeah,
good
my
one. That's a
closet
good
is very
place.
cozy.
Like I got my chair too. I can rock now and adjust.
Getting old, rocking.
No, I'm
Just
not getting
kidding.
old. No, I'm not getting old. No, I'm not. I'm so active. I can't even believe how active I am. It blows me
You know what's
away.
the worst thing someone can say to us is that we are getting old. Someone said I look like Terry Hatcher. You know what? I have been told that for so many years. I was on a flight with my son years ago, and they actually thought I was Terry Hatcher.
Yeah, you look
That's a
like Terry
compliment.
Hatcher. You really do.
Yeah.
It's a compliment,
But
of
no, I
course.
don't like anyone criticizing my ability to move or anything, Mel. I'm with you. We are not getting
Um,
old.
Yeah.
Yeah.
look,
Someone asked if I lost weight. I didn't really lose that much weight. I lost maybe 5 pounds.
honey, you've
But
lost more than that. No,
no,
you have lost
but
more than that.
no. but
Yes, you
no,
have. Since the show,
no
you've lost
carbs.
probably a good 10 pounds since the show. I think so.
Well,
Yeah,
someone
about
asked me how I'm doing with no carbs and no sugar. I did really good until the last 2 days of the ski trip. There was a girl, she asked me to go get coffee. She was on the trip, and there was this place, this restaurant, they had cookies this big, and
donuts.
I ate part of one. I cheated. So
That's
the
all right.
last
All
two
right.
days,
It's all
yeah,
right.
I like sweets.
My
Oh, I
face
love
Mel,
looks
your
thinner.
face looks thinner. Okay, how about uh, Mel? You look great. His face looks thinner.
Yeah, he lost 10 pounds. I would say a good 10 pounds. I'm trying to get Dr. Reddy on here. I think sometimes he has a hard time getting on.
Leave it to the
I mean,
cardiologist and doctor not to
right,
be able to figure it out, right? We're going to be talking
right,
about diabetes, part
right.
two.
And then next week we
Yeah,
have my friend Gil Suarez. He's next Wednesday. He's going to be speaking about sleep apnea, and he has a whole sleep apnea clinic here in Vegas.
that's going to be
Yeah, so
great.
that's going to be
Yeah.
good. Yeah, and he was a dentist before. He had his own practice, and he went
Was
into the
he?
whole. Yeah, so you're going to like him a
Yeah,
lot. Gil's, yeah,
dentists are really good because we are the first line that really noticed sleep apnea. And I have a friend that just closed her practice, her general practice, and now all she does is sleep apnea here in Houston. So it's a
right.
big deal.
It is. It really is. So he has a whole clinic here. Yeah, so that's
Yeah.
going to be good next
Is
week,
it
and then
just
after,
is it just sleep apnea?
I don't know. We'll have to ask him. There he is.
Hey,
Hi,
Kota,
Dr. Reddy.
Hello.
Dr. Reddy, can you raise your head so you're in the middle of the screen?
Or lower your camera.
Good evening. Okay, how's this? Better?
That's
Yeah,
better.
just
Over
you need to be like us where you're in the middle, a little bit high. You
first.
need to be higher up.
Thank you, Dr. Reddy, for coming on tonight and finishing diabetes. We appreciate it. So we're going to finish tonight on part 2 of diabetes.
Okay. Are
Yes,
you ready with all your questions?
we're ready. We're all ready.
Well, I
Okay.
imagine some are going to be repeat ones because you're going to have some new listeners on as well.
Excellent. So, hey, before we start, Mel, what did you change last week?
I've been doing the same thing. I just been cutting out, carbs and sugars. Like if it tastes, like you said, if it tastes sweet, I usually don't eat it. But I still eat the fruit though.
Okay, that's fine. Because remember, you do exercise a lot, and if you basically eat more of a keto diet, you don't eat a lot of carbs, then fruits are not an issue. People tend to eat a lot of carbs, and then they eat sweets and fruits. Makes it worse.
Yeah, I don't eat. I don't eat many carbs and no like candy or desserts or anything like that. No sweets like that. None.
Perfect. One
And
other
no
thing is,
cokes.
one other thing, if most people actually did something, things would be much better.
If they did what?
Walked. If they walked after having a meal.
We
I
talked
tell my
about that.
patients, every time you eat something, walk for 15 minutes in the house. You don't have to go outside. It makes a big impact on your health.
What happens? What happens?
So what happens is, even if you eat something with a little bit of starch, the starch goes up, meaning your glucose goes up. So once your glucose goes up, you're now asking the insulin to come out to bring the glucose down. But if you start walking in the house or even outside, you don't need to release insulin. Basically, whatever the glucose that comes up is used up by the muscles without the need for insulin. So if you
Okay.
do it for 30 minutes, let's say you do it for 30 minutes every day as a ritual, guess what happens? Every person who has done that has come back to show me excellent numbers. That's why I said.
Wow. That's a hack right there.
And you're in only
It's a
15
simple
minutes,
hack.
doctor.
Oh, before
Can't hear him.
15, 20
Yeah.
minutes. So one other thing. Recently, I was just reading something about mitochondria. For the last few weeks, I've learned more about mitochondria. So this scientist, what he did was he took 5 sets of rats. One set of rats were completely normal. The
Hey,
other
Dr.
4 sets
Reddy.
of rats,
Dr. Reddy.
he basically went into the mitochondria and changed their DNA. Just a minor change. Hello?
You're breaking up really badly. Is he breaking up on you guys?
Yeah, he
Yeah,
is.
yeah. He
He
has to
is.
So,
change
do you
his
have another
locale.
place in your house you can go? Because I can hardly, you're breaking up.
I think we had this problem last
Okay.
week as well.
Give me a minute.
Yeah, his internet, he's got a bad connection.
I'm going to
Remember,
have to go over to his house and help him out.
Okay.
yeah,
How about, can you hear me? Nope, 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 nope.
You're blurry too.
That'd be good. Two?
Yeah, pixelated is I think what they call it.
You don't look like us. You look like an alien, huh?
I mean, I am an alien.
all right, that's better.
But
That's
now, can you hear
better.
me?
That is better. We'll see how that goes.
Okay, let's do this way. So when he looked at all these rats, you know what happened? The first set of rats which took the stress, nothing happened. In fact, they improved. The second, third, and fourth, fifth sets of rats, every one of those developed a different form of disease manifestation. And his one statement was, all diseases are linked to mitochondrial dysfunction. So I want you to understand one thing. If you want to be healthy, make your mitochondria happy and healthy. If you keep your mitochondria healthy, you don't have to worry. If you keep your mitochondria dysfunctional, then you'll be going to doctors because you'll have so many different manifestations of different diseases.
What's the secret then for your mitochondria?
Secret is, imagine a coin. It's got two sides, heads and tails, and the coin itself. Heads is sleep, tails is stress, and the coin itself is hydration. These are the three variables. If you correct these three variables, sleep, stress, and hydration, 98% of the battle is already won.
Sleep is a big deal. You know, I was on my trip skiing and skied really hard. But when I got back, even though I got back at 11 o'clock last night, I was not tired today because I slept like 7 hours a night, and I slept really well. Sleep is so critical, isn't it?
Yes, it is.
That is true. That's why I said, imagine a coin, sleep, stress, and hydration. If you correct these three, 98% of the battle is already won. And always remember, all roads lead to mitochondria.
Some people are asking about magnesium. How does that help? Magnesium tablets.
Okay, there are 6 components that are actually needed for the improvement of the brain. One is magnesium. The other one is K2. The other one is vitamin D3, B12, and DHA. Of these, the most important is magnesium, which we don't usually pay attention to. So yes, do I need magnesium? Yes. Should I take magnesium? Yes. What do I recommend to patients? You know, what's simple is go to Whole Foods and pick up this Calm, 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 or even online, buy that and add 1 teaspoon of it to the water and drink it. That should do it.
What about a gummy, a magnesium gummy? That's what I have.
Should be fine because remember, you add a lot of other things into the gummy. That's why I don't like gummies.
But
Not those gummies.
The other gummies, not those
Yeah,
gummies.
the other gummies.
Pills are so hard for me to swallow. Pills are difficult
No,
to
but
swallow.
it's just powder. You just add it to the water and drink it.
What's the name of it?
Calm.
CALM, calm.
Oh,
I've
Calm.
used that
Okay.
before.
Yeah.
Yeah, it's
It's
good.
actually easy. I mean, you'll actually like the taste. It's not hard. I mean, it's an easy. What do you think, Peg?
I like it. It was easy. You just put it in a little tablespoon, teaspoon, whatever it is, and you mix it up, and it was good. It was really good.
That's
It has
right.
like a
And also, yeah.
fruity
It's called
flavor. It was
Calm.
Yes.
CLAM.
Yeah.
It's a fruity
And
flavor.
it also will help you sleep better.
Yes, it does. I think you can get it on Amazon as well, you guys. I think I've gotten
right.
it off of
You know,
Amazon.
can you just get that magnesium in your normal vitamins, your dailies?
You can, but it's not that same amount of dose because you're talking about almost a gram or so, or even more. So when you're actually taking in a teaspoon form, you're taking more than 4 grams or 5 grams.
So,
But again,
you take it at
if
night?
you eat at night, in fact, it'll help you both. It'll help you with relaxing. It'll help you with feel better, and it actually helps you sleep better.
So one of the questions was, what about a multivitamin? Can you just get your magnesium from the multivitamin?
But you may not get enough. That's what I mean.
Okay.
Somebody just said Costco has it. For all the listeners, Costco has it. Yeah.
Costco's got everything.
They got everything. Yeah.
Good. So let's start. Who wants to ask the first question?
All right.
One.
Who out there
What
has a
you,
question?
go ahead.
I'm reading the questions. Let's see. Magnesium. We talked about magnesium. Calcium. How about calcium? They're asking about calcium.
Okay, so this is what I tell my patients when they say, "Oh, I'm taking calcium." So I ask them a question: Why do you take calcium? Oh, to help build bones. So, okay, if you take calcium, can you build bone? The answer is no. Okay, second,
Mhm.
if you take calcium and your vitamin D3 level is low, will you absorb it? The answer is no. Okay, then I'll take vitamin D3 also. So if I take vitamin D3 and take calcium, will I be able to absorb the calcium? Yes. But the next question is, once I absorb the calcium, does it go to my bones? The answer is no. So then what's the point of taking calcium? So then the next question is, then why am I taking calcium? To build bone. Okay, what should I do to build bone? If you want to build bone, you have to lift weights to build muscle, resistance training. If you build muscle, you build bone. If you do not build muscle, you will not build bone. There's no point taking calcium. It's useless. Then what is the best thing to do? Take vitamin D3 with K2. That's rule number one. Rule two, get your calcium from nutrition, food, what you're eating. And three, lift weights. If you don't follow these three rules, it's practically useless thinking of calcium.
Dr. Reddy, so going back to weight training, a lot of people, I call them skinny fat because they just get on a treadmill or what have you, or the Stairmaster, but the Stairmaster is not weight bearing. Doesn't it need to be weight bearing exercises such as actually
Yes, it
lifting
has to be
like
weight bearing
weights?
exercise where you
Yeah.
actually tear the muscle to build muscle, which in turn helps you build bone.
Well, hang on. Let me ask you a question. You're talking about the
Ask me.
Stairmaster, and I do the Stairmaster a lot. So you're still fighting gravity because I don't go step by step. I take two steps. So there's a lot of pressure and stress putting on my knees and my buttocks and my hips. So the Stairmaster, it may not be weight bearing, but you know, doing it is very arduous.
Yeah, but you've got weight bearing because of your body weight. You got 200 and 30 pounds or whatever it is. That's your weight bearing right there, isn't it, doctor?
Would walking be better than the Stairmaster? I'm interested in what you have to say about the
No,
Stairmaster.
actually, Mel is right because when you compare to walking, Stairmaster is definitely superior. And if he were to actually do the stair, which he's doing anyways, he's not doing one step, but he's doing two steps. That's even more stressful on the system. Third is if he puts on weights on
Uh-huh.
his chest and does it, then it's even better.
So
So
what
yes,
type of weight-bearing exercise beside weights between Stairmaster, treadmill, cycling, what would you say would be the most benefit for
the
our
best one
listeners?
is farmer's walk, kettlebells or any weights in your arms, and then walk in the house.
Oh, really?
Wow.
That's
Okay.
simple.
Okay.
How that'd be like taking the trash out.
Yeah.
Depends
Depends
on
on how
whose
much trash
trash
you
you're
collect.
talking about.
Yeah, but you know what I'm saying.
Yeah.
And you're saying for about
That's
15 to 20 minutes, right, doctor? 15 to 20 minutes. Some
yes. In
weights,
fact,
walk
after
around the
eating,
house.
yes, after eating, pick up small kettlebells and walk around the house for 20 minutes. That's it. You're doing
Okay.
everything.
Somebody wants to know about what about vibration plates?
Oh,
Oh,
yeah.
that's a good way to build bone too. In fact, standing on the vibration plate will help build bone. And in fact, there's a place called OsteoStrong. They do 15 or 20-minute exercises once or twice a week and actually really helps build bone. But yes, using a vibration plate also helps.
How does that help? I just find that fascinating. You sit on that because I've used it at our gym. We have one. How does that build muscle and bone, or not
Okay.
muscle but
Okay.
bone?
So they claim it's because of the my vibrations, which are helping you build a bone. But the second thing is, don't sit on it, and also depends on what level of vibration you're
Mm.
using it. So now, if you put it at very high frequency vibration, you're vibrating, but after some time you feel dizzy. Why would you feel dizzy? Because your brain is also vibrating, and you don't want the brain vibrating at that high pace. So decrease the vibration where actually you can control it, but at the same time you're moving with the wave as though you're on a yacht or a boat. guess what? What happens? You're constantly moving and you're trying to control your balance. If you're doing that, you're having controlled movements. And when you're doing that standing and squat, you actually have a better bone response.
Oh.
How often should people get bone density tests? You know, I still haven't gotten to get mine. I still have not gone to get
Well,
mine.
do it once and see if it's normal. If it's normal, don't do it for the next 5 years. But if it's not normal, then start exercising and go and check it next year. I'll give you an example.
At what age should people get the bone density test?
Doesn't matter because you're actually seeing osteoporotic bones as young as 45. So it doesn't matter. Go and get it done. It's not going to hurt you. At 78, my father when he turned 78, he got his bone density done. It was abnormal. So his physician said, take this medication to build bone. So I was there in California at the time. So I said, do not take the medication. He said, what should I do? Go to a gym, hire a trainer, and start working out 3 times a week. Every week, 3 hours. He did that. Guess what happened after 3 years? Went back and got his bone density done. All his negatives became positive.
Well, the medicine for osteoporosis can manifest itself in the mouth, and you can lose a lot of bone in your mouth. I have diagnosed 3 patients that we had to send to the oral surgeon to have bone removed. It causes a lot of problems. Would you agree?
Absolutely. Think about ask a simple question. How does the medication work? There are 2 types of cells, osteoclasts and osteoblasts. B, blast will build the bone. C, clast cleans up the bone. So you need this yin and yang working on the bone to help remodel the bone based on everyday stresses. So when you take this medication, what are you doing? You're killing the C, osteoclasts. That means there's no cleanup. There's no cleanup crew. So you continue to build bone. What happens is you have a dense bone, but it's not resilient. So when you put stress on it, it'll just snap. And you don't want bones like that.
Yeah.
It's called osteonecrosis. Osteonecrosis.
Yes, osteonecrosis of the jaw. Plus, then if you look at the side effects, you'll be shocked. So why would you want to do all those things? Instead, standing on the vibration plate, farmer's walk, lifting weights with the help of a trainer, doing all these things will only help you and not hurt you.
If you don't have kettlebells in your house, you could actually do it. You could walk with 2-gallon jugs of water, right?
Yes, yeah, that is correct.
How about just going out and walking? How about what I do is I actually run with 4-pound weights and a 10-pound vest. But let's just say you don't do that. You just go out and walk with like 4-pound weights.
But if you can even run, that's even better.
Yeah.
But then you got to be careful at your back. Some people.
Yeah, I don't do it after I don't do it after I eat though.
Do you walk with the vest?
You don't need to run after you eat. You can just walk. Sorry, Terry, what did you say?
They're weight vests, but I think they put a lot of strain on your back. But weight vests are good as well to walk with, right?
That's correct. Yeah. But you're also right. If you put more weight on the chest and if your core is not strong, you are going to hurt your back. Yeah. So always focus on the core. 84-year-old patient came in. He was built like a bull, solid ox, strong guy. So I said, what is your secret? I mean, 84, you're so strong. He said, I spend every day spending 2 hours just doing core exercises. And he's been doing this ever since he was 40.
I love him. I don't spend 2 hours, but I'm a good 45, 50 though.
That's very good.
You're abnormal. You're like a super athlete.
Yeah, but but you know, let me tell you, because I hurt my back playing football, right? I mean, I played on a bad back for, I would say 11
many years.
Well, I played 11 years in the NFL, 5 in Michigan, so 16 on a bad back. But the only thing that saved me was core. If I didn't have a ironclad core, I'm not playing.
Mel sets the bar.
Well, I'm just telling you my experience.
But everyone should be like that.
I'm being serious. It's a compliment. You set the bar. I mean, you are so fit. You're 67. You're incredibly fit. You walk the walk. And I think that you could inspire a lot of people, especially as we get older.
That should be our goal for everyone. We should all be like that because we have to focus on improving the core and exercising as much as possible.
So when I went skiing, I was with the Dallas Ski Club. And there were 60 of us, and more than half were in their 70s. And there was a gentleman that was 87 years old.
Wow.
It was very inspiring. So people need to realize as you age that you can still be super active and take care of yourself. There's a question here about biotin. They want to know, is biotin safe? I hope so because I take it.
The best source of biotin is egg yolks. Eat as many as you can.
14 a day for 14 years. I didn't die.
That's my point. Oh, he remembers that. Hey,
You know,
see, even
that's
your memory is excellent, Mel.
Yeah.
right,
Is eating
exactly.
raw eggs bad for you?
Depends on where your egg is coming from. Again, if you know the source, then it's okay. Otherwise, you can always eat it poached. And if it's poached, it's partially cooked. And the best source of biotin is egg yolks. And when you
Okay,
poach an egg, what happens?
but Dr. Reddy, you got to answer the question about the person want to know about biotin chewables or whatever
Supplements.
vitamins.
It should be fine.
Okay.
I have an interesting story. So my daughter, because there was a big crave a couple of years ago. We were biotin, it helps your hair and your nails. So my daughter and I, we got some biotin supplements. We started taking them, and both of our hair, and I don't know why, you guys, but it started to shed so much, and we had to quit the biotin. So I am like nervous, to take it because of what happened when we took it. Maybe we didn't need it and we overloaded our system. I don't know. It's
So that brings up
interesting.
the interesting two stories. One patient said, okay, you know what? I'm low on vitamins, so I'm going to start taking multivitamins. He started taking a lot of vitamins. And after some time, what happened was he was walking and he would fall with no reason, apparent reason. So he came to my office saying that, hey, I've already fallen 4 times. I don't know why. So we sent him to a neurologist who did all the tests and said, everything is normal, but I don't know why you keep falling. Then his daughter said, Dad, you're taking too many vitamins. Why don't you stop them? So he
Mm.
stopped them. 3 weeks later, everything normalized.
Why was that, you
Another
think?
story. Another story. I said, okay, I'm losing a lot of hair. So I said, who has the most hair? Pregnant women. And what do? They take prenatal vitamins. So I said, let me take some prenatal vitamins, see what happens. I went to Whole Foods, picked up prenatal vitamins, and came home and
And you
took
got
them.
pregnant. No, I'm just kidding. Go ahead.
You can call me Junior. So anyway, so I got home, took the vitamins. Next day, I and my daughter went to watch a movie. Remember, I'm a movie buff. I can watch movies 16 hours straight, back to back. So I'm at the movie theater. Next thing I know, I'm psychotic. I can't control my thoughts. It's vague and weird. So I said, what am I doing wrong? Why am I feeling like this? Realized could be vitamins. I stopped them, of course. Then 2 weeks later, took the vitamins again. The same thing happened.
Wow.
What do you think these vitamins are doing? The additives in the vitamins can really mess with your brain. So be careful.
Why
Melanie
would
That's
was
you
why,
just
take
talking about
prenatal
that.
vitamins, Dr. Reddy?
listen, everything I do, I experiment. This was many years ago. I'm talking about 15 years ago. I had a crazy idea. I said, let me go try it. It's not going to hurt me. Prenatal vitamins are not going to hurt me. That was the concept. Do prenatal vitamins hurt you? The answer was no in my mind. So I tried it. Now, do I take any supplements? No, except for prescription Vasepa and prescription vitamin D3 with K2. I do not take any supplements, and everything else I have to get it from food. And once in a while, I take calm. I don't take it all the time because I try to get magnesium from foods.
Mel and I were just talking about this before we were on the phone, and we were talking about taking, supplements and how the vitamins out there, the vitamin industry, there's so many fillers and so much junk that goes into the vitamins that basically it's for the money. Bottom line is because it doesn't give you what you need nutritionally. And sometimes if you overload your body with things that you don't need, where does that go? It has to go somewhere. It does if you think about it.
I agree with you 1000%.
Yeah.
Okay,
Someone wants
Dr.
to
Red,
know
let me ask you
about
a question
CoQ10.
about
Ask me.
you said you take K2 and D3 in a prescription. Um,
Yes.
Two questions: why, and then which prescription?
Okay. First, I'll ask the latter question. Decara, Decara. Decara is a prescription brand only vitamin D3 with K2. Ask your primary care physician to give it to you. It usually comes in 25,000 or 50,000. In my case, I take 50,000 once a week, and my vitamin D3 levels are 80 for the last 4 years consistently. They
You
don't
take it
drop.
once a week,
Once a week. I take it every Sunday evening. I take it
and that lasts you the whole time.
the whole time. And I've been
Okay.
4 years, I've been checking my vitamin D3 levels. They're always 80.
How
Perfect.
come?
That's one.
How? What about just going out in the sun for 15 minutes?
Excellent. So I said, you know what? I'm going to try and experiment on myself. So I and my family went to Bora Bora with another family. So once in Bora Bora, I said, you know what? This is the best time. I'm just going to put my shorts on and lay down in the sun and burn myself. So after 48 hours, I burnt my skin so badly that I couldn't go back. It was like hurting. So in the meantime, I checked my B12 level before I left Houston. It was 37. After being there for 10 days, came back, I checked my B12 level the next day. It was still 37. That was the day I learned that sitting in the sun for a few hours and burning yourself is not going to work. At the same time, around the same time, two Caucasian patients came at different times. Both of them had vitamin D3 levels more than 130. So independently and individually, I told them, guys, you're taking too much vitamin D, stop it. Both of them said, we don't take vitamin D3. I said, how would you have vitamin D3 that high? Okay, patient number one, every afternoon from 3 to 4, he would swim. If he swims, what happens in the pool? He's exposing his trunk and he's making his vitamin D. Patient number two, every afternoon, he would go garden with just shorts on. That's when I realized that you have to A, expose your trunk to make vitamin D. B, you have to expose it every day. And C, just because you go and lay on the beach for 8 hours, 2 days in a row, it's not like a solar panel that it just tanks you up.
So a little bit every day then.
A little bit every day. But remember, if you that's why golfers, gardeners have low vitamin D3. Why? They're completely covered, and except their face and hands are exposed, you don't make vitamin D.
Yeah.
Even if you wear shorts and cover your trunk, you don't make enough vitamin D3. I've tried all those experiments. You have to expose your trunk. Now, I'm not going to go out there and sit naked 45 minutes every day.
But what about so if you go out and get sun on a regular basis, do you need the Dakara prescription?
No, if you're going to do that, you probably don't. If you do that and check your vitamin D3 levels are like 60 or 70, then you don't.
Mm-hmm.
But if not, most of us, what you said is ideal situation, but most of us cannot do it. One, we don't have the time. Two, we won't have outdoor activities to do during the time and there's enough. And three, you may not be living in a place where you have enough sunlight. So you're better off just taking Decara. If you don't want 50, take 25 once a week. Start off with that.
Okay.
Dr. Reddy, a lot of people want to know about CoQ10, what your thoughts are on that.
Okay, if you just ask me, I want to take CoQ10 just for health reasons, I will say no. Two, I want to take CoQ10 because I'm taking statin. In some patients who are on statins, CoQ10 actually helps, but that's only like 6 to 10% of the time. Yes, take CoQ10. Third, I just want to take it because I like it. Don't, because it's got a lot of side effects and it can also mess with your sleep. Again, going back to one thing, if you want to improve your mitochondria, what are the three things? Hydration, sleep, and stress. You don't want to do anything that will mess with you. And the same thing with vitamin supplements. If you take vitamin supplements and other supplements in evening, notice it will mess with your sleep. One of the CEOs of the hospital here, we were talking, and he said, oh, I have a problem with sleep. Every night I've got bad dreams. I can't sleep. I said, what do you do in the evening? Do you take any supplements? Yes. I said, why don't you give them up? Gave them up. Symptoms changed.
Dr. Reddy, when would be the best time of the day to take the supplements? Morning, lunch, or evening before you go to bed?
If you're going to take supplements, take them in the morning. Don't take any supplements in the evening because they can and will mess with your sleep. Two, if you ask me what are the basic supplements, again, as we discussed, prescription vitamin D3 with K2, Decara, and the other supplement I recommend is B12. Not any other supplement, just B12 sublingual under the tongue, 5,000 international units every day. That's not going to hurt you because most of us are vitamin B12 deficient, even if you eat the right kind of food. And the third one is prescription fish oil called Vasipa, EPA only. These are the only three I recommend to my patients. Now, if you're nutritionally deficient, then take some vitamin. But I've never seen anybody deficient in vitamin C or any of the B complex.
So another question, aspirin. I know that a lot of people will take, their cardiologist recommend them to take a baby aspirin every day, but I've been reading currently that that's not necessary anymore. What are your thoughts on that?
For 15 years, I've been telling my patients, do not take aspirin unless it's indicated. Indicated means if you had a stroke or if you have heart attack, or if you have a stent put in. If you don't have it, do not take an aspirin, because you know why? Aspirin is a blood thinner and you can bleed. Two physician friends of mine, both of them 65, both of them are not on any other medication, just cardiac protection, aspirin only. Both of them around plus or minus 1 week tripped and fell on their buttocks. That's all. And no damage done. Woke up, everything was normal. Within 2 weeks, they had such large bleeds around the brain that had they waited for 1 or 2 more days, they would have died. Why? Because of aspirin. Now you
Yeah,
ask them,
they fell on their butt and their brain bled. No.
yes, because see, when you fall, the impact on it causes the brain to move forward and backward. When that happens, the shear force on it, if you're on blood thinners, you could start bleeding. And that's exactly what happened to them.
Even if you're taking a baby aspirin, like
Yes.
a
So
baby
now,
one.
81. So now when I ask them, hey, what do you think of aspirin? They laugh and say, no aspirin, unless it's indicated. Think of
So,
it this way. Think of it
Dr.
this way.
Reddy,
If you, yeah.
so basically, just don't want to interrupt, but I am interrupting. So as a dentist, when patients, we do thorough health histories, if they're telling us they take a baby aspirin, it's really important to be off the baby aspirin about 5 days before your procedure, because you'll have a lot of bleeding present. So
So
that's a really important.
So my question to everyone who's listening is, why do you need to take aspirin or thin the blood? Why do you need to thin the blood? You mean to saying the body doesn't know how to thin itself? How do I keep my blood thin? There's only one variable. What is the third variable? Hydration. If let's say if Mel and I have a plaque in our arteries, and both of us have plaque rupture, and both of us are closing our arteries, one of the two is going to have a heart attack, another one is not. Mel is hydrated, he won't have a heart attack. I'm dehydrated, I'll have a heart attack. Why? Because when you are dehydrated, what happens to viscosity of the blood? It increases. What happens to flow? It's like crude oil. It flows slowly compared to water. Then what happens? If you have a plaque rupture and slow flow, increased viscosity, you're going to clump and form a clot. So going back to the variable, hydration. Okay, let's say two patients have atrial fibrillation. Both are at risk for strokes. One of them has it, one of them does not have it. Why? The one who has it is dehydrated. When you're dehydrated, viscosity goes up, you form clots in your upper chamber, you throw a clot, you have a stroke. Everything links back to hydration. So instead of hydrating, we take
You're
aspirin.
freaking me out here.
If I were to come up with a new drug called aspirin and go to FDA, they would not approve the drug based on its side. But why is aspirin advised? Because it was grandfathered in and nobody had to apply for FDA approval.
Oh, yeah.
So let me ask you a question about. I read an article today, and also one of my friends had a heart attack shoveling snow. So it was higher in men, but the one who died was a woman in her 50s. So I read the article. It said that, it's cold and everything's upper body. You're usually a little bit older. You're not hydrated. Can you talk a little about shoveling snow? Because people in the Northeast now are getting swamped or, snowed in.
Is it possible
So
she did it right after she ate?
I don't know, but she died though, shoveling snow.
that's a very good question. If you have a big meal and you go to shovel snow, you are at higher risk. Again, if you give me a few minutes, I'll take you back. You imagine a clean artery. If you have a clean artery, you shovel snow, you will not have a heart attack. Good. Second, if you have a small plaque, about a 20 or 10% plaque, if you have a plaque like that, but it is stable, if you shovel snow, you are not going to have a heart attack. If you have an 80% blockage, but it is stable, you'll have angina, chest tightness, but you will not have a heart attack. If you have a 20% plaque, but it is not stable, now the question is, how can we not? That means you have formed the last 2-3 weeks. That means in the last 2-3 weeks, based on your diet, you have created a plaque. Now that plaque is unstable. If you have a
Dr.
plaque
Reddy,
like that,
you're
You're
breaking
breaking
up.
up
and
again.
shovels
Breaking up.
caught up.
You're
This is the
breaking
best
up
I can
again.
see. I
Yeah.
can see 3 bars here.
You can
You
see
need
3
5.
bars, but we ain't hearing anything.
You
You're
need
breaking
5.
up.
I need 5, but I can't get 5 here. Next time I'll do it from the office. That's easier.
Okay.
So what about
So can
another
you hear me
question
now?
was ibuprofen.
Oh, that's another one. Stay away from ibuprofen. There was actually a study done on Celebrex, not Celebrex, Vioxx, and it was pulled out. Merck used to make Vioxx, and people who were taking Vioxx had increased heart
Yeah.
attacks. So Merck had to pay for it, and it was taken out. How is Vioxx any different than ibuprofen? It's the identical medication. So the only reason ibuprofen is not taken out is because nobody's there pushing ibuprofen, and there's no company takes ownership. That's one of the reasons. So can the same heart attacks happen with ibuprofen? The answer is yes. So if you have a plaque that is unstable and you take ibuprofen, you are risking plaque ruptures.
Well, okay. Well, let me ask. This is a personal question. I have a lot of body aches from playing. When I ache, I'll take it 800 milligram. I don't take it all the time, but
Can
sometimes
you
I gotta
try?
take it.
So can you do three things? Before you take it, make sure you're fully hydrated. Second, instead of taking 800, take 200 milligrams. Third, take a Tylenol. So take Tylenol with 200 milligrams of ibuprofen, or you can take 200 milligrams of ibuprofen, one baby aspirin, one Tylenol together, and stay hydrated. And three, sit in a ice bath. If you sit in an ice bath and then take it, you'll fall asleep.
Okay.
So you don't
But
That
recommend,
way,
like sometimes I prescribe 600 milligrams of Motrin for my patients. So I don't prescribe Vicodin. So I'll prescribe Motrin. Are you saying that 600 milligrams of Motrin, I should maybe be prescribing 200 milligrams of Motrin or 400 and then Tylenol like 250 or 500 with it? And then make sure the
that
patient hydrates before they take it?
That is correct. Because remember, you can still have the same benefit by taking 200 milligrams. You don't need 800 milligrams. One lawyer friend of mine came in, and I looked at his labs. His normal creatinine is zero point 0.8. His was 2.5, and almost 90% of the kidney was gone. So I said, hey, what are you doing? I said, I don't know. I'm not doing anything wrong. I said, are you taking any Motrin ibuprofen? He said, yeah, I've been taking ibuprofen. Why? Because my orthopedic friend said, oh, you got some joint ache, so just take one tablet, 800 milligrams twice a day. So I've been doing it for 6 months. It basically killed his kidney. More
Mm.
people have died because of kidney damage and failure because of ibuprofen. Nobody even thinks or says anything about it. Ibuprofen can cause gastritis, can cause bleeding, can cause kidney damage, can cause kidney failure, will cause blood pressure to shoot up, will make you retain water and put you in congestive heart failure. You don't want to risk all these things. So if you absolutely have to take it, take the lowest dose and pair it with Tylenol and aspirin together. Stay hydrated. That
why
helps.
together? Why together?
Because remember, each one is going to act differently. Tylenol is an analgesic. It's not an anti-inflammatory. So that acts from a different pathway. Aspirin is like ibuprofen, analgesic and anti-inflammatory. And ibuprofen acts differently as an anti-inflammatory. So when you combine these three, you have an exponential impact on your pain.
But more important, Dr. Reddy, more important is that ibuprofen and the non-steroidal anti-inflammatories are metabolized in the kidney, and Tylenol is metabolized in the liver. So you're not going to have overexposure of the kidney or the liver. You want to mix it up, right?
So that is so correct. Actually, that you brought up a very good point. Tylenol goes to the liver. That means if you take Tylenol every day, you're going to kill your liver. How do I know that? Patient came in for a fibro scan. We did a fibro scan and found out he had almost severe scarring of the liver. He doesn't drink. He doesn't have any bad habits. So I sent him to a gastroenterologist, and he looked him, evaluated everything, and came back and told me, hey, you know why he's got scarring? I said, why? Because he takes Tylenol PM every night for the last 3 years. He's been doing that. It almost killed his liver. So that's one good point. Second is, if you take aspirin, aspirin does not kill the liver or the kidney. It just causes gastritis. Now, ibuprofen kills the kidney and causes gastritis. So when you take these three together, you're actually helping your system heal of the pain, but you're not causing severe damage long term.
But what about the chronic pain though? I mean, or the acute pain. I have chronic pain all the time. I can deal with it. But sometimes you go, I just gotta have it. In the 800, you're saying is not the.
I mean, why don't you try 200 with aspirin Tylenol and see
I'm
what
going to.
happens?
I'm going to.
And the
Dr.
second thing
Reddy,
is
the Tylenol, 250 or 500 milligrams with the Advil.
250, 250.
Okay.
And the second thing is, hey, if you have a place, Restore close by, go and do cryo every evening for about 3.5 minutes. That will really help with your pain. See, if you sign up for their membership, it's like $9 per session. Just go there and do the cryo. When you do the cryo for 3.5 minutes, 3 minutes, right? They tell me 3.5 minutes, 15 minutes. I almost push it to 4 minutes. So if you do that, it's not only going to help you sleep well, but it'll also help with your inflammation.
At,
So you
at
do
night, at night, do
cryotherapy.
the cryo.
Yes. Go
What
and do
about
the
if I just
cryo
jumped in
every
my
week.
pool? I jump in my pool. It's 50 degrees.
But it's not the same because cryo takes it down to minus 150 for 3 minutes. That really helps you. It drops your core temperature almost 26 to 30. So that really has an impact on your pain. Try that.
Try
People
it. You
want
might
to
as well
know what
try it.
cryotherapy is and how often do you do it?
How
Dr. Reddy?
often?
I do it because remember, you only spend 3 minutes 15 seconds. So by the time you run in, change your clothes, and get in and do the cry and get out, in 6 minutes you're out.
How
But
about if
they
you have
don't know
high
what
blood
it is.
pressure?
Do
What
you
if
want to
you
explain
What?
what it is?
what if
Okay,
you have high
cryo
blood
is basically,
pressure?
yeah, cryo is basically a chamber where the temperature is kept very low, a liquid nitrogen. So you have your underwear on, you go in, you stand there in the cold chamber for 3 minutes 15 seconds. If you can push it up to 4 minutes, that's even better. And then you come out. That's it.
What about if you
And
have high
it's
blood pressure, doctor? Is that okay to
if you
do
have
it?
high blood pressure, I mean, when you say high blood pressure, if your blood pressure is like 200, that's a problem. But if your blood pressure is like 140, 150, that's not going to hurt you.
Okay. Okay. Fantastic.
I have a question here. What about sauna?
Oh, yes. In fact, one day, not one day, I was reading an article, and this 75-year-old Caucasian male, NIH has been following for almost a few years. They are trying to figure out why this gentleman is not developing Alzheimer's like every one of his cousins, first cousins, second cousins, and third cousins who inherited the gene. All of them developed Alzheimer's by 50, 55, whereas this gentleman is not. So come to find out, they realize that the reason he has not developed Alzheimer's is all through his life, he worked close to boiler room where boilers were. So he was always exposed to high heat. And because of that, he was sweating. It was like sitting in a sauna. And the moral of the story is when you sit in the sauna, you're actually triggering the release of heat shock proteins, and these proteins actually help the protein in the brain and prevent it from developing tau proteins, which are the key hallmark for developing Alzheimer's. So yes, why should I do sauna? To get rid of my toxins. What else? To improve my brain, to protect against dementia, to drop my blood pressure, get rid of excess salt, help my kidney. How do I know that? A patient of mine was on dialysis. He said, I figured something out. I said, what did you figure out? Before I go for dialysis, I go and sit in a sauna. Guess what? Instead of spending 3.5 hours in dialysis center, they kick me out in 1 hour and I don't go home exhausted. I'm able to do everything else. And he continued to do that until he got a kidney transplant. So one professor at Texas A&M came to me and said, I'm going to quit. I said, why are you quitting? Because I can't take this. I've got chronic fatigue. I've got anemia due to thalassemia. My kidney function is getting worse. And I've got swelling in the legs. I've got high blood pressure. And I cannot do anything. And my diabetes is okay. 3 things. 1, eat vegetables and meat, boil and eat. I said, done. 2, go sit in the sauna for 40 minutes or 30 minutes every day. He said, done. 3, exercise every day. He did this. Guess what happened? His kidney function improved. His blood pressure dropped. He was off his medications. He was not on any diuretics. His swelling in the legs disappeared. Even count improved. He dropped his medications. Blood sugars normalized because he changed his medications, changed his diet and started exercising. And he went back to teaching, and he's still teaching. And his kidney function is still normal. It's been almost 5 years. He sits in the sauna every day. He says, I will never give it up.
For how long? How long?
He sits for 30 minutes, half an hour. He
So
does
What
that
Dr.
for
temperature?
Reddy,
What
we've
temperature?
got we've got the cryotherapy, the cold, we've got the sauna. How do you fit all that into your weekly regimen?
Let me answer the first question Mel asked. What temperature? It's 180 Fahrenheit. So
Okay.
this is a dry sauna. You get the wet sauna and the dry sauna, steam sauna. This is a dry sauna. It's 170 to 180. That's the
And
heat.
dry's better. Dry's better,
Dry is
right?
Dries better, yes. So for you, Mel, if you can do the cryo and then go to the dry sauna, you see a big improvement in your inflammation right
Okay,
away within
let me
24
ask you a
hours.
personal question. What you would do if you could put a sauna in your home,
I
would you
would
do
do it
it?
in a heartbeat.
Yeah, hell yeah.
Really?
But I
Wow.
have a boss who controls, so I cannot do it without her permission.
Yeah. But if you could, you would.
I
Oh, I
would do it.
would.
In fact, I tell my patients, it doesn't cost you much. If you want a nice built-in, it's only $1,000. Put it in your house.
Mm.
Everyone should have a sauna. I strongly urge you to do it. If you can do it, do it.
What about sauna, infrared, and red light?
Well, you can do infrared, but infrared won't take you to as high level. If you can put a sauna in the house, you don't need infrared. If you cannot put a sauna in the house, then get an infrared. It goes up to 140. So it's second best. But is it best? No. What is best? Dry sauna.
Maybe.
Is it
So
expensive? No. Can it be done? Yes.
Okay.
between dry sauna and cryotherapy, which do you recommend the most?
Most I would recommend easy is cryo because it takes only 3 minutes, 15 seconds. If it's
Mm.
something close to home, drive in, go sit in the cryo and get out. That's it. Now sauna is it's like an expedition. You go in, you sit there, you sweat, you go take a shower. You have to spend time. So I do that mostly on the weekends.
What about sauna if you were diabetic?
Doesn't matter as long as you're hydrated. Okay, what's the problem? Good question. What's the problem with diabetic? When they eat something starchy, their glucose goes up. When their glucose goes up, they start to diurese and become dehydrated.
Mm.
But if you eat the right diet and your glucose is normal,
Well, there he goes again.
Oh, that's frozen right there.
Yeah, now he's frozen.
you try to sign back. I don't know what to do to help.
You're
Now, am I back?
frozen. You had too much cryotherapy. You're frozen.
Yeah.
That's nice. I like that one. I like that one.
Can I sing a song?
Go ahead.
Ca- can I sing a song from Frozen? Can you
Oh
hear
yeah.
me?
So Dr. Reddy, this is like really interesting information for me because I don't sit in the sauna as much. They have one at the gym, so now we'll make an effort. And then, so listen, you've got cryotherapy, you've got red light, and you have the sauna. So now we put red light. Red light helps reduce inflammation. Sauna helps reduce inflammation. Give our listeners like a regimen that makes sense of how you would incorporate all three, or would you?
No, very simple. Sit in the cryo. Easy, quick, more benefits for the buck. Second, on the weekends, go sit in the sauna. If you're retired, go sit in the sauna every day. If you're not,
Mhm.
if you're working, then on the weekends, go sit in the sauna. Otherwise, cryo, cryo, cryo. And red light, if you're doing these two, you really don't have to focus on red light therapy.
Wow.
What
There's a
about
question.
cold plunge? What about cold plunge?
Cold plunge is good, but then see, cold plunge takes your temperature to a certain level, whereas cryo takes you much lower than that. See, cold plunge depends on the location. It could be 0 degrees centigrade or -3. This one goes even further out. So you are better off. Second, cold plunge, you have to get up and again dry yourself out. Here, you don't have to. Just put on your shorts, go in and get out and get out. Get
Mhm.
back to work or go do whatever you want. So it's the best of all worlds is cryo
Oh,
instead of cold plunge. I've tried them
that's
all. I
good.
said, you know what? This is not going to help. Let me just go to cryo. It's so easy.
I guess we're gonna
Yeah,
have to
It's
try
like
it, you guys. We're gonna have to
it's like
yeah.
try cryo.
Superman jumping, go run into the store, take your clothes off, go in, get out, boom, you're done,
That's good.
We're gonna have
and
to
you're not
try it.
wet.
Hey, look, I just want to continue my own questioning here. What about
Ask me.
TRT?
Expand. What do you mean?
Okay, the therapy, the testosterone
Oh,
therapy.
that's my favorite topic. So one day I found my testosterone was low. So I went to a friend who's
What's low? What's low? What's low?
like it was like around 320. So it's like a cutoff is
So,
like 300 and over. So mine was 320. It's low. So I was not happy with my number. So I went to my friend and I said, look, I'm on the low testosterone side. But I need some samples. He said, okay, here are the samples, but you have to read this paper before you take the samples. I said, I'm not reading any damn paper. I'm not going to take the sample. He said, no, you're not going to get the samples. So he forced me to read it because physicians don't read side effects, let alone the patients. And okay, first thing it said is, if you have sleep apnea, testosterone, it get worse. Don't have apnea, it's going to cause sleep apnea. Okay. Second,
Mm.
if you're on testosterone, you have to get your blood checked every 3 months because it's going to increase your blood count. It is going to increase the viscosity and it's going to put you at high risk for blood clot or heart attacks. Third, you have to get your prostate checked every so often because you're at higher risk for prostate cancer. So I said, you know what? Keep your paper, keep your samples. I don't want it. I went back, sat back and asked, why is my testosterone low? So I did some reverse engineering. The one thing it comes back to, again, what were the three variables? Sleep, stress, and hydration. So I said, okay, if you're under stress, what happens to your testosterone? Goes down. That's a simple variable. If you correct stress, what happens? Your testosterone comes back up. So what did I do? First, I found out if I had sleep apnea or not. I had sleep apnea. I corrected sleep apnea. Second, I kept myself hydrated. Third, of course, I was not consuming any caffeine. And fourth, I dropped the stress. Guess what happened? My next lab, testosterone went up to 550. So
Oh,
the
wow.
point was simple.
Awesome.
America is stressed and America is on caffeine. When you're stressed on caffeine and you compromise your sleep, what happens to your testosterone? 90% of people who have low testosterone are not because they primarily don't make testosterone. It's just that we are all being plagued by chronic stress that's killing us.
Mm-hmm.
Now,
Can you build testosterone up? Can you build it up?
absolutely, I just told you, by just correcting the factors, sleep, stress, and hydration, it'll bounce back.
Mm.
So
What about
what about
women?
the little, let's say if you go get a little bump, then what happens?
Jesus. All right, we're not going there. Hold on, doctor.
All
There's
right.
a question. I want to. You know what?
All
Enough,
right.
Mel. Okay, here's
You guys are
a
killing me.
listener. Enough. All right. A listener said, "I had AFib. My cardiologist told me to take aspirins. Should I ask to stop?"
Okay, if you have atrial fibrillation, based on your age, you have to ask what is your CHAD score. If your CHAD score is more than 1, you need to be on a blood thinner called Eliquis or Xarelto, not aspirin. Unless you have atrial fibrillation and your electrophysiologist put in a watchman device in your heart, once he does that, then you have to take aspirin for the rest of your life. Yes. But again, depends on where he is. If the patient is 30 years old and atrial fibrillation, no other risk factors, aspirin alone will do the trick. If the patient is more than 65 and he has atrial fibrillation, then aspirin will not do the trick. He has to be on a different blood thinner, Eliquis or Xarelto. If not, he has to get a watchman put in. You
Oh,
have to be on aspirin. So that I don't actually don't know where the patient is.
okay.
We're getting
Dr.
back.
Reddy?
What?
Dr. Reddy?
Yeah.
What
Yes.
about
Can you hear me?
hormone replacement therapy for testosterone in women if they are totally depleted?
Before doing that, I asked them to go to a gynecologist, get a complete evaluation, and yes, get on it.
All
I
right.
would say yes.
This has been great, you
Next
guys.
question.
Any other questions?
Well, we talked a little bit about the diabetes before, and you explained, how to, lower it, if you're like a type 2, I guess.
Type
Can
2,
you,
not type 1, type 2. Yes.
type 2. Is there,
Yeah.
can you go quickly over that,
Oh,
to bring it down,
okay.
or get rid of it?
If you have type 2 diabetes, adult onset diabetes, that means you are making insulin, you are insulin resistant, and in that scenario, you want to make yourself insulin sensitive. And in order to make yourself insulin sensitive, you need to stop stressing the body by eating a lot of starch. So then what should I do? Starve the diabetes. How do I starve the monster called diabetes? By one, A, eliminating caffeine, B, eliminating all fructose in the form of sugar and fruits, and C, giving up starch for how long? For 100 days. D, walking after eating, and E, having dinner by 4 o'clock. That's it. If you do these few rules, you will be able to reverse diabetes in less than 100 days. Well, after that, what do I do? Can I go back to eating starch? If you become insulin sensitive and get your A1C less than 5.5, yes, you can go back to eating starch. Can I go back to eating late at night? No. If you go back to eating late at night, you will again rekindle the diabetes. Well, can I go back to eating fruits every day? No. Once in a while, yes. Every day, unless you're Mel, it is not going to work.
So, Dr. Reddy, I have only had
That's a
one
good one,
Rotten
doctor.
apple
That's
in
a good
5
one.
days since our last series here.
So what do you
I
do?
got off fruits. I got off fruits.
But wait a minute, but why? Why did you do
Yes.
that, Terry?
You know how
Because
many
is your
patients who have come and told me ever since when you get off fruits, whatever excess fat you have around your waist will disappear.
oh wow.
Dr. Reddy said so.
Okay.
You lose your fat very quickly. So if
Wow.
you do two things, if you give up sugars and have early dinners and walk after eating for 15, 20, 30 minutes, you'll be surprised how quickly the body changes and the fat composition changes.
Okay.
And another thing you covered last time, but I think it's something that people want to hear: statins.
Oh, yeah. So statins are the drugs used to lower your cholesterol. So this is what I tell my patients. If your cholesterol is high and you want to bring it down, change your diet. In spite of changing diet, your cholesterol is still high and you want to bring it down, do not take a statin. Ask your physician to give you a medication called Ripata. Why? Because statin prevents the cells from making cholesterol. Ripata does not. Statin hurts the mitochondria. Ripata improves the mitochondria. Statin does not help in shrinking the plaques. Ripata shrinks the plaque. So if you want to shrink the plaque, not hurt the liver, and statins decrease the brain cells from making cholesterol. Ripata does not. So if you want to improve your brain, improve your mitochondria, don't hurt your body or your muscles, not have fatigue, and get your cholesterol down without mitochondrial damage, Ripata is the way to go.
There we go.
What
Wow.
a wealth of knowledge you are. That is just fascinating. Thank you for all this information.
Thank you
And
for
that
all
and
this
that was only
information.
his B material.
Right?
That's all.
And just a little bit tell everybody what's coming up. I don't know if you can about your app. Can you talk a
Oh
little bit
yeah,
about your
I'm
app
still
that's coming
working on
up?
an app. I'm waiting for the Apple to approve my app. So once they approve it, we're going to release it for 1,000 patients and have them work on it in 3 to 6 months. Once it's perfect, I'll let it out for prime time. It's called Ask My Doc.
And all this information that you've been talking about is going to be on there. So it's going to be,
Yes.
yeah, it's going to be great. I can't wait till it comes
Everything.
out.
In fact, I have 600 videos which I've done, and every day I spend hours creating documents to feed the agent. So every document I create about the 200 frequently asked questions. So by the time in 6 months, the agent will have so much information that any question you can think of, the agent will have an answer and explain what you're doing wrong and what you need to do.
You know
Yeah, I
what feels good,
love that.
Dr. Reddy? Remember 7 years ago when you were on the show with my brother and I, a radio show? I discovered you.
That's
You are awesome.
Thank you. Hey,
Well,
so
we're actually gonna fly down to have a
please come
consult.
on over.
That's right. We need an appointment. What date is April? I think it's April. I'll text you, Dr. Reddy.
Let me
April the
know.
23rd, I think we're going to be down there and we want to have an
Awesome.
appointment and do all this blood test and really, yeah, it's going to be fun.
And
It's going
Let's
to
I'm
be a
do
lot
it.
of
coming
fun.
with them.
Huh?
I'm coming with
Very
you
And
good.
you're
guys.
coming with us.
We're
Terry's going to
coming
be
to
there.
Houston.
Mel's going to be there. And yeah, we're going to do the blood test and we're going to get, where we're at with everything. And then we can take it from there. It will be fun to see where we're all at with our blood.
All
Let's
right.
do it.
It'll
Perfect.
be fun.
Thank
Thank
you.
you.
Thank you
So
so
one
Yay.
much.
last parting statement. All roads lead to mitochondria. Protect your mitochondria. That's what life
That's
is
the
made of.
engine, right? That's the engine.
That's the engine. Yeah, that's right. That is the engine. That is a battery pack of the cell. So protect it, nurture it, improve it by sleeping well, giving up stress, and staying hydrated.
Wow.
Adios.
Love it. Thank you
Peace
very much.
out. Thank you so much,
Thank
I'm going
you.
to go
Doc.
Thank
drink
Thank
my
you.
you.
water. Good
Ask your
night.
Thank
doc
you.
right
That's
there.
right.
That's
Thank
right.
you so
Okay.
much.
Thanks,
Thanks
you
again.
guys.
Thank
Thank
you.
you,
Bye-bye.
doctor. All right, everybody. Thank you for,
Until next time.
Yes.
till next time, doctor. Thank you.
Yes. Always a
We
pleasure.
have these, he's great. Isn't he great, you
God.
guys? He's
So good.
absolutely, he's amazing. He really
I'm
is.
glad I know him. Thank you, Terry.
You're
Thank you,
welcome, Mel.
Terry.
See, Mel, if I hadn't been on the show, I wouldn't know you. You wouldn't know him. I wouldn't know Peg.
It all
True.
works out.
It does. So what we're going to be doing, you guys are asking when our lives are. Right now, we're having them every Monday night and every Wednesday night. And right now, I think we might narrow it down to every Wednesday. I don't know. But right now, we have Mondays and Wednesdays, 6 o'clock Central or 8 o'clock Central time, and then 6 o'clock Pacific time. And we
I
have
think,
different doctors on.
yeah, and I think in the future he'll be in the rotation,
Oh, no, 100%. We're
right? I
going to
mean,
have
but
him.
yeah,
Yeah.
some other doctors, but we're trying to get a broad spectrum of different people on,
I'll be
talking
on
about
talking
different
about
things.
teeth. So,
Yeah,
Yeah.
we have you on for the every
Actually, you know what? You
quarter.
guys, that's a really good idea. What I'll do is we'll make a flyer because we've already booked until the end of March, basically. So I will
that's a great
list.
idea.
Yeah, we have everybody. So I'll list everybody that's coming on. We have a hormonal specialist for women. Then we've got Charlene. She's just a fitness badass, right? Shailene,
Shailene Johnson.
yeah, Shailene Johnson's coming on. Next week's going to be Gil Suarez. He's going to talk about sleep apnea,
And
and
I'm
then
gonna try to
after
get my friend Dr. Dan Friedrich on. He's a neurosurgeon
neurosurgeon.
who's a brain doctor. So he'll be talking about concussions, and he have some other pet projects
That'd
he's
be
doing too.
interesting.
That would
He's
be
really
very
he's really
interesting.
good. I've conversed with him a lot of times, and I've met him also. So he's a special guy, and
Good.
he's also a pianist too. So
Oh,
good
is
music
he?
guy. Yeah.
You
Oh
know,
yeah.
all the doctors are very musical.
Yeah. He's
Yeah.
he's an incredible guy.
That's interesting. That's great. Yeah,
All
so
right,
Mondays
guys.
and Wednesdays. So everybody stay tuned. And this Wednesday, it's going to be Gil Suarez, and he's going to be talking about sleep apnea. So we'll see everybody then.
Good
Thanks, you
night.
guys.
Thank
Good
you. Thank
night.
you. Thank
Bye.
you. Thank you.
Bye.